Huh? I gotta say. So today our first question, what are the causes of syncope? So syncope means sudden loss of consciousness due to reduced cerebral circulation. It is known to us. And there are different causes of syncope. Cardiac syncope, that is caused by myocardial infarction, hypertrophic cardiomyopathy, complete heart block, that is known as stroke. Stroke হবে, not stroke. Stroke Adams attack. The syncope that occurs due to complete heart block is known as Stokes-Adams attack or syncope. So, acute myocardial infarction, hypertrophic cardiomyopathy, and your severe aortic stenosis, then your complete heart block that produces Stokes-Adams syncope. These are cardiac syncope. Another is vasovagal syncope that occurs due to sympathetic stimulation. Any stressful condition, any sad news that stimulates the sympathetic nervous system, causing syncopal attack, that is called vasovagal syncope. Another is postural syncope, that is occur due to prolonged standing. Standing is spelling mistake, prolonged standing. Cough syncope, it is another distress syncope. Micturition syncope, those patients who suffers from benign enlargement of the prostate have distress as or discomfort or distress during micturition that may produce syncopal attack. So these are the different types of syncope. Next is what is TIA, transient ischemic attack. It is a variety of stroke. Occurred symptoms and signs recovered within 24 hours. Recovered within 24 hours. It is TIA. What are the cardiac manifestations of rheumatoid arthritis? That is endocarditis that causes aortic regurgitation, mitral regurgitation due to involvement of the endocardium. That is called endocarditis. Involvement of the pericardium can produce pericardial effusion. Involvement of the conducting system of the heart produces conduction defect. Involvement of the myocardium produces myocarditis. Even involvement of the coronary artery and coronary vessels produces coronary vasculitis. So these are the different cardiac manifestation of rheumatoid arthritis. Next is what is Reiter's disease. It is characterized by followings, which occurred within 1 to 3 weeks after sexual exposure or diarrhea, infective diarrhea, especially Shigella infection. So within 1 to 3 weeks of sexual exposure or Shigella infection, thread of symptom occurs, that is oligoarthritis. Oligoarthritis means when 4 or less than 4 joints are involved. It is called oligoarthritis, conjunctivitis, and non-specific urethritis. It is not gonococcal urethritis, it is non-specific urethritis. Most likely, it is caused by chlamydia infection. What are the causes of occult GIT bleeding? Occult means that is not naked GIT bleeding, which cannot be seen by open eye. It is called occult GIT bleeding. And the causes of occult GIT bleeding are C. rectum, CA colon, and any cause of GIT bleeding can cause occult GIT bleeding. What are the common causes of blood loss anemia? What are the common causes of blood loss anemia? One is bleeding peptic ulcer disease, ruptured esophageal varices, gastric erosion, C stomach, C rectum, hookworm infestation, and rectal polyp, inflammatory bowel disease, especially ulcerative colitis, diverticulitis, angiodysplasia, and anesite-induced bleeding. So these are the different causes of blood loss anemia. And in female, excessive menstrual bleeding can also occur, causes as this blood loss anemia. What are the effect of vitamin-C deficiency? It produces swollen and gum and bleeding from gums. Not only swollen gum, the gum bleeding from gums, delayed wound healing, and petechial hemorrhage, that is perifollicular hemorrhage, hematosis, bleeding in the joints, anemia, and GIT bleeding can also occur. Now, what are the complications of scabies? Impetigo, it is a secondary infection of the skin. Eczematization of the skin can occur also, and post-streptococcal glomerulonephritis can occur in scabies. What are the effects of poisonous snake bite? Local effect, bite mark, bleeding spots, bluish, local swelling, blister formation. These are the local effects. And systemic effect, neurological systemic effect, third nerve palsy, cardiovascular effect, hypotension and shock, vascular defect, DIC, disseminated intravascular coagulation, renal effect, acute kidney injury, musculoskeletal system, rhabdomyolysis. So these are the systemic effect of poisonous snake bite. Now the card number 13. And what is malignant hypertension? It is characterized by grade 3 hypertension. Grade 3 means the systolic blood pressure more than 180 and diastolic blood pressure more than 110. And so it is the level of blood pressure, number one. Number two, there will be renal dysfunction, and that is characterized by proteinuria or retinopathy, grade 3 or 4 retinopathy. So if severe hypertension or grade 3 hypertension with renal parenchymal dysfunction, that is proteinuria or retinopathy present, then it is called malignant hypertension. What are the causative organism of scabies? The causative organism of scabies is Sarcoptes scabi. And what are the complications? We have already learned it. What is the presentation of benzodiazepine poisoning? It causes drowsiness, confusion, ataxia. Respiratory distress usually occurs in severe form of benzodiazepine poisoning. Hypertension also occurs in severe form of benzodiazepine poisoning. Stupor, spelling mistake is stupor. It is pre-coma condition and coma that occurs due to severe form of benzodiazepine poisoning. What are the causes of headache? There are two types of headache. One is primary headache, another is secondary headache. Primary headache is three types: tension headache, migrainous headache, and cluster headache. And secondary headache caused by sinusitis, meningitis, encephalitis, ixol, subarachnoid hemorrhage. What is ricket? Ricket is a metabolic bone disease which occur in children due to deficiency of vitamin D. And what are the features of ricket? Ricket child present as healthy baby. Muscles are soft and flabby but weak. Muscles are soft, flabby and weak. His milestone of development is delayed. He cannot sit, stand and walk in time. There is delayed closure of the anterior frontanelli. Later on there may be knock knee and bow leg. Swelling of the costocardinal junction of the chest, that is called ricket progery. What are the cardinal features of leprosy? First change in leprosy is skin change. In tuberculoid leprosy, a depigmented macular skin lesion with loss of sensation. And this skin lesion is discrete, scattered, and asymmetrical, not widespread. And in Leparomatous leprosy, the lesion is Papulo-nodular skin rash with anesthesia. And the lesion is diffuse skin lesion and it is symmetrical, widespread, but the facial skin is become thickened and there is loss of eyelash, giving the appearance of leonine face. Neurological involvement in leprosy: post-auricular knot, radial knot, ulnar knot, median knot, common peroneal knot, sural knot, posterior tibial knot. These knots are commonly affected in your leprosy, and nerves become thick and tender with loss of motor and sensory function. What are the diagnostic features of rheumatoid arthritis? And number one diagnostic feature is arthritis of the hand joints. Second, symmetrical arthritis. Third, polyarthritis, that is more than 4 joint areas are involved. Number 4, muscle morning stiffness, not muscle stiffness. Morning stiffness more than 1 hour. Rheumatoid nodule will be present. And rheumatoid nodule is a nodular structure in the elbow joint and in the forearm. RA test positive and radiological change in hand occurs, and that is detected by soft tissue swelling, reduction of the joint space, marginal erosion, periarticular osteoporosis, and marginal sclerosis. So these are the radiological change in rheumatoid arthritis, and duration of symptoms more than 6 weeks. If any 4 out of these 8 criteria is present in a patient, it is diagnostic of rheumatoid arthritis. What is diarrhea and what are the causes of diarrhea? Diarrhea means frequent passage of loose stool more than 3 times in a day. And cause are viral cause, rotavirus, adenovirus, and bacteria E. coli, salmonella, shigella, and staphylococcus aureus. Now the card number 14. What is the presentation of the Plasmodium vivax? Plasmodium vivax is a variety of malaria and it is characterized by tertian type of intermittent fever. And this fever is repeated after 48 hours. And the fever has 3 stages. Cold stage, which comes with shivering and rigor and persists for half an hour to 1 hour. And second stage, hot stage, is present with high fever and persists for several hours. And third stage is stage of sweating. The fever subsided by profuse sweating. How will you treat acute gout? Acute gout is treated by NSAID, that is, drug of choice is naproxen sodium, 500 mg BD daily, and second drug is colchicine, 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 0.5 mg tablet, 1 tab BD, 2 tab BD daily till pain subsided. Third drug is allopurinol. Allopurinol is a drug which reduces the uric acid level, and dose is 100 milligram, 1 tab twice daily. And those who are not suitable patient for allopurinol, they can be treated by Prevostat, allopurinol contraindicated. So these are the treatment of acute gout. What are the effects of vitamin B1 deficiency? Vitamin B1 causes dry beriberi, which is characterized by peripheral neuropathy. Even food drop can occur. Wet beriberi, it is characterized by generalized edema, especially dependent edema due to heart failure, and other neurological features are burning syncope, which is characterized by acute confusional state, ataxia, and nystagmus. Ataxia means abnormal gait, and nystagmus means frequent involuntary oscillatory movement of the both eyeball. So these are the three criteria of burning encephalopathy: acute confusional state, ataxia, and nystagmus. And Korsakoff psychosis is a permanent and damage, neurological damage caused by your vitamin B1 deficiency. Here, recent and past memory is lost, and the patient developed confabulation. Confabulation means an falsification of the word. Patient is very accustomed to tell false. It is Korsakoff psychosis. What is epilepsy and what is pseudo-seizure? Epilepsy is a clinical event caused by hyperexcitability of the cerebral neurons due to abnormal electrical impulse, characterized by repeated convulsion with or without loss of consciousness. So epilepsy is a clinical event and which occurs due to hyperexcitability of the cerebral neurons and characterized by convulsion with or without consciousness. But pseudo-seizure, it is a conversion disorder. It is not a organic lesion. There is no organic lesion in the brain like your epilepsy. It is a conversion disorder characterized by convulsion without tongue biting. The patient doesn't develop tongue biting, and there is no oral salivation, no involuntary micturition, and only convulsion can occur. So it is pseudo-seizure. What are the features of OPC poisoning? The first symptom of OPC poisoning is foul smell of OPC. Second is your bronchoconstriction, bronchospasm, dyspnea. Third is bronchodiuria, frothy salivation, meiosis, that is constriction of the pupil, muscle fasciculation, twitching, muscle twitching occurs, ataxia, abnormal gait, coma, confusion and coma can occur. Even convulsion, coma occur in this patient. What are the characteristics of eczema? Acute eczema is characterized by papullovesicular rash with irregular margin. Margin will be irregular, and within the margin, the skin has developed papullovesicular rash, and margin is red swollen, with some exudation, and there is intense itching. So these are the features of acute eczema. So margin irregular, within the margin papullovesicular rash and exudation present, and intense itching present. But in case of chronic eczema, the papullovesicular rash with scaling, but oozing, exudation is less. Exudation is less, scaling is more, and papullovesicular rash present. It is the character of chronic eczema. How will diagnose and treat acute pancreatitis? Investigation of acute pancreatitis is serum amylase. It increases within 48 hours of symptom. And lipase, it is increased from the onset of this symptom and persists for several days. And ultrasonography of the pancreas shows swollen pancreas, edematous pancreas. Treatment of acute pancreatitis, hospitalization, nothing by mouth, and nasogastric suction if vomiting present, IV fluid, 5% dextrose aqua, normal saline, and Hirschman solution, 3 liters per day. Injection timonium hydrochloride to relieve pain. Injection ketorolac 30 mg BD if pain not subsided by timonium. And injection PPI 30 mg IV BD should be given. Intake output chart. After relief of pain, oral drugs with capsule pantoprazole, tablet pancreatic enzyme, tablet timonium hydrochloride, soft and liquid diet, and control of diabetes if present. How will you manage acute MI if patient come within 8 hours? First of all, hospitalization of the patient. Second, maintenance of ABC, airway clearance, and breathing by oxygen inhalation, and circulation by IV channel opening. And tablet ecosprin 75 mg 4 tab start, then 1 tab daily. And to relieve pain, injection pethidine with stimatil, and injection thrombolytic agent, especially injection streptokinase 1.5 million units in 100 ml normal saline, IV over 1 hour. Injection enoxaparin 40 to 60 mg subcutaneous BD daily for 5 days. Tablet atorvastatin for cardiogenic shock if developed, injection dopamine, and the patient may be referred to CCU for further complication if developed. So this is the end of today's class. So I think the question are very easy, but answered promptly should be prepared and delivered. Answer should be promptly delivered, and prepared yourself in this way. And don't hesitate, don't take time to tell answer. You will prepare yourself so that you can very promptly, quickly, and accurately give the answer, and that will help you to get a good marks and pass. This is the technique of